Hi all, myself Beno Paul. I am working at SNS College of Physiotherapy. So today we can see about the spinal cord injury. So what are we can see first what is a spinal cord injury and etiology and types and clinical features, investigation and loss management. So first we can see about a spinal cord injury. So spinal cord injury mainly affected or injure the spinal cord. So it can leads to any symptoms like paraplegia or quadriplegia. These are the main symptoms. So spinal cord injury basically in around worldwide we have 17,900 new cases are seen in the US. So spinal cord injury mainly damage the spinal cord, and it have a certain types. First is complete versus incomplete. So complete means that is fully total loss of below the injury level, total loss of motor symptoms, motor affect and sensory also affected, and incomplete is a partial function will be affected. And the remaining classification is classified by the neurological level and also in Asia impairment scale. That Asia impairment scale have A to E grade. So that's a complete, incomplete, that's all the Asia impairment scale. So causes, mainly spinal cord is injured by certain causes, that is traumatic causes and non-traumatic causes. Mainly traumatic causes, it leads to the road traffic accident. So mainly any accident that involve to affect the vertebra, that leads to the spinal cord injury, and fall. So in older age peoples we have risk, mainly risk fall, so that also leads to the spinal cord injury. And violence, any violence can create spinal cord injury also. And this is are the traumatic causes. And non-traumatic causes, mainly tumor. So tumor that form in the spinal cord, spinal cord layer with any type of tumors can formed, and it can leads to the spinal cord injury. And also infection due to certain injection or any virus that can affect the spinal cord, so that leads to the spinal cord injury. And vascular malformation, that is mainly involved in the spinal artery. So spinal blood vessels, any vascular malformation that leads to the spinal cord injury. So these are main causes affected the causes leads to the spinal cord injury. So next types. So types of spinal cord injury, we have a complete injury, incomplete injury. So complete injury, there is no motor and sensory functions, so that affected below the level of the injury. And incomplete injury, some partial involvement, so partially affected the motor function or sensory function. And remaining types, that is specifically in syndromes, we have 3 syndromes, four syndromes: central cord syndrome, anterior cord syndrome, posterior cord syndrome, and Brown sequence syndrome. In central cord syndrome, it mainly affected the central part of the spinal cord, that leads to the whole body partial motor weakness, that is a quadriparesis. So mainly involved in upper limb, so upper limb motor functions are affected. And Brown sequence syndrome, so ipsilateral side we can affected the motor function, and also loss of pain, temperature in the ipsilateral side. And anterior cord syndrome mainly affected anterior part of the spinal cord, so that leads to the loss of the temperature, pain. And posterior cord syndrome, that affected the posterior cord of the spinal cord, so that also leads to the loss of proprioception. That's all most common. So these are the specified syndromes present in the spinal cord injury. So next, clinical features. In spinal cord injury we have certain clinical features. So first we can see motor deficit. So motor deficits mainly affected by the paralysis and weakness, any weakness in the upper limb and lower limb. and spasticity. So prolonged patients can create spasticity. So these are the motor deficit. In sensory deficits, loss of sensation or tingling sensation and loss of pain. And autonomic dysfunction clinical features, we can see a bowel bladder affected the bowel and bladder function, and blood pressure alteration, altered blood pressure and temperature also. And in respiratory issues, we have a cough impairment. So cough impairment mainly breathing difficulty. So and neurological levels we can see, and a certain level. So cervical level we can affect quadriplegia, and thoracic level paraplegia, and in lumbar level we mainly in lower limb weakness, but we have involved in bowel and bladders also. So investigation mainly by physical examination, that is assessment of motor and sensory assessment, and imagery techniques, X-ray, CT, MRI, we can see the spinal cord injuries. So medical management, so first in spinal cord injury mainly stabilize the patient so that prevent the secondary injuries and maintain the spinal alignment. And medications, we can give a steroid and pain control to reduce the inflammation. And surgery, we can under the surgery decompression spinal fusion, and also intercars have support breathing and monitoring vital signs. So today we can see that all about these